today's webinar. Before we get underway, I would like to take a moment to acknowledge the land on which I'm working from and the traditional people of this land. I am currently working in Thorold, which is from the Niagara region. This is the traditional territory of the Haudenosaunee and Anishinaabe peoples, many of whom continue to live and work here today. This territory is covered by the Upper Canada Treaties and is within the land protected by the Dish with One Spoon Wampum Agreement. Indigenous practices of health and well-being have been in place on this territory for thousands of years and are maintained to this day. As a settler, I am grateful to have the opportunity to work on this land. To learn more, a website link will be pasted into the chat. This website is run by the nonprofit organization Native Land Digital and can be a resource to help us learn about the Indigenous lands where we live, learn, work, and play. Before we begin, I would like to tell you a bit about Nutrition Connections. Our team works to provide services to health professionals, businesses, government, community organizations, educators, researchers, and others working in food and nutrition to help them learn, connect, and share information on food, nutrition, and healthy eating. We are a key program of the Ontario Public Health Association, which is recognized as a charitable nonprofit organization. As a registered charity, the proceeds from the sale of resources and services goes towards work that promotes public education on nutrition and healthy eating. At this time, I would like to go through some housekeeping items. We ask that if you have a technology question, that you please submit your inquiry through the chat box. And if you have a question for the presenter at any point during the presentation, please submit those into the Q&A box, which you should find at the bottom of your screen. So before we begin, I just have a few words about our presenter. Lynn Roblin is a registered dietitian and served as senior policy consultant for Nutrition Connections for over 6 years. She supported knowledge exchange and actions to promote healthy eating and food literacy through policies, programming, and advocacy at the local, provincial, and national level. Lynn is currently involved in applied research activities to increase understanding of the state of healthy eating and food literacy in Ontario and Canada, including the reports you will hear about today. Welcome, Lynn.
Thank you, Sandy, and good afternoon, everyone. And I'd also like to thank Nutrition Connections for this opportunity to come back and report on some of the work that I was doing at Nutrition Connections and OPHA in the last several years. Anyway, where I'd like to start is just giving you a little bit of background information on 2 of the reports that we have already released. One, we have been investigating the determinants of dietary intake through a number of reports. The first one, we looked at food literacy, food and fruit and vegetable consumption, and food insecurity based on the 2014 Canadian Community Health Survey. And more recently, we looked at food insecurity and implications related to COVID-19 using more recent data. We'd like at this time to acknowledge the Public Health Agency of Canada, who provided us with access to the CCHS data for these reports. Doing this kind of work is important as these reports help inform evidence-based policy, programming, and communication activities to improve food literacy and healthy eating in children, youth, and families. You can find these 2 reports already on our Nutrition Connections website, and we'll be giving you the links at the end of the presentation. So just like to point out another report that we did in the past year, and this one was supported by the Elderly Foundation, and we worked with Ipsos to acquire the data on eating trends among Ontario families. This report focused in on Ontario and Canadian families, including parents and children of different age groups, and it helped us understand what food and eating attitudes and behaviors drives their food choices. We learned, for example, that sugary snack consumption was highest for children ages 2 to 5 years at dinner time, and the use of screens at mealtimes was also reported to be high among the same age children. We found that less than half of families were eating together at a kitchen or dining table, while over 1/3 were eating in front of the TV. This is a problem as evidence shows us that eating while watching TV or using screens can cause distracted eating and is linked with poorer food choices and beverage choices. We also learned that half of families source their food and nutrition information online, while the word of mouth and television were also important. The internet, including social media and blogs, play a major role influencing food choices. However, there is a lot of misinformation out there. Media also provides advertising that can influence children's food choices, and this is mostly for sugary and salty and higher fat foods. So it's important for us to understand what eating behaviors exist and what drives food choices, because unhealthy eating is a leading cause of chronic disease. In Canada, for example, not eating enough protective foods such as vegetables and fruit, whole grains, milk, nuts and seeds, and consuming too many foods that are considered harmful, for example, processed and red meat, sugar-sweetened beverages, this contributed to $13.8 billion per year in healthcare costs associated with diseases such as cancer, heart disease, and type 2 diabetes. In Ontario, unhealthy eating has been estimated to cost the Ontario economy $5.6 billion each year, with $1.8 billion lost specifically due to inadequate vegetable and fruit consumption. So this brings us to our two new reports. While the previous reports gave us insights to food literacy and food attitudes and food insecurity, we wanted to know more about the intake of various dietary components to see if there were any areas of concern. The first report, we focused in on nutrient intakes and also vegetable and fruit intake. The second report, we focused in on beverage consumption. Again, we would like to acknowledge the support of the Helderly Foundation and the work of researchers at the University of Toronto, who we worked with to analyze the data for these reports. So just before we begin, I'd like to outline a bit about the study design. The data was based on the Canadian Community Health Survey nutrition component from 2015. The sample included Ontario and Canada and was representative for both. Adults and children who were non-breastfed over the age of 2 were included. Excluded were people living in institutions and on reserve. The mean usual daily nutrient intakes were estimated using the NCI method. This requires a 1 day of 24-hour recall and a subsample of a second day recall to estimate long-term usual intakes. We used all available days from the CCHS 2015 pump files. This method was chosen instead of estimating mean intakes from a single day, as it provided a better estimate of long-term dietary intake. All results were stratified by dietary reference intake, age, sex groups, and the DRIs for population surveillance were provided as a point of reference. Comparing to the DRIs in this case did not assess level of deficiency or adequacy of intakes, and it's important to note that. Results for the national sample were provided by Mary Labbe, Alina Ng, and Mavra Ahmed from the University of Toronto, and they have recently published their data on the national report, and the references here attached on the slide. So here we go. We just wanted to highlight some of the nutrients that we felt were giving us some concerning results. For instance, in the sodium area, high sodium intake we found was a concern for all age sex groups in Ontario, with a large percentage of the population, especially males, exceeding the chronic disease risk reduction intake levels. Males ages 14 to 18 had the highest estimated daily sodium intake at 3,621 milligrams per day, which we determined was about 1,300 milligrams more sodium than the CDRR intake level for their age, which is equivalent to about 3 servings of large fries. Sodium is a concern as over 30% of hypertension cases in Canada are due to high intakes. Reducing Canadians' daily sodium intake by approximately 1,800 milligrams per day would save $1.38 billion annually in healthcare costs. Bakery products such as bread, muffins, and cookies, mixed dishes such as pizza, lasagna, and frozen entrees, and processed meats account for half of the total sodium consumed by Canadians. For potassium, We found that adults over the age of 19 in Ontario may not be meeting their need for potassium, although the interpretation of the adequacy of nutrients with an AI is limited. We found that mean usual daily potassium intake from food and beverages for adults over 19 was 2,899 milligrams for male and 2,329 for females. The sodium and potassium intake patterns are important as they can influence long-term health through complex relationships with dietary intake, blood pressure, and cardiovascular health. For example, not consuming enough potassium and consuming too much sodium can contribute to high blood pressure. The sources of potassium in our diet include vegetables, fruit, dairy products, fish, beans, and legumes. Vitamin D, we found, might be a concern as mean intakes for all age sex groups in Ontario fell below the established estimated average requirement of 10 micrograms per day. Males on average had higher intakes of vitamin D compared to females. While our report only considered intake from food and beverages, not sunshine or supplements. Even with fortification of vitamin D in staple foods, Canadians may not be meeting recommendations for vitamin D, especially in the winter. So it's important to continue efforts to increase intakes of vitamin D-rich foods, such as unsweetened dairy and fortified plant beverages, margarine, eggs, and fatty fish. And also age-appropriate supplemental intakes of vitamin D. For calcium, there may be a concern that females 9 years of age and older and males over 71 may not be meeting recommendations for calcium in Ontario. And again, this was from food and beverages alone, as we did not include supplements. Calcium is important for people of all ages to help build and maintain healthy bones and teeth. Calcium also plays a role in keeping your heart, muscles, and nerves working properly. The main sources of calcium are found in milk, yogurt and cheese, calcium-fortified dairy alternatives, fish, beans, almonds, and some vegetables. For fiber, we found that mean intakes were below the adequate intake levels recommended for children, youth, and adults. For example, 38 grams of fiber per day are recommended for males and 25 grams per day for females, ages 19 to 50. Our study found that mean usual intake was only 18 grams per day for males and 14 to 15 grams per day for females, suggesting room for improvement. Fiber is important for proper digestion and is linked with improving satiety, controlling blood sugar, and lowering cholesterol levels. Fiber is found in vegetables and fruit, whole grains, nuts, seeds, and legumes. We also looked at the distribution of caloric intake, and we found the proportion of daily energy from carbohydrate, protein, and total fat were within the acceptable macronutrient distribution range, with half contributed by carbohydrates and 17% from protein. Energy from total fat contributed 33% to total energy intake in Ontario. Although daily energy from total fat across all age sex groups in both Ontario and Canada were in the acceptable range, the World Health Organization recommends not exceeding fat intakes above 30% of total energy. Energy from mean total sugar, including free sugars, contributed 20% to total energy intake in Ontario. Sugar was highest in the youngest age group and declined with increasing age. Based on CCHS 2015, desserts, sweets, and beverages were the two food groups that contributed the most to added and free sugar and total sugar from the Canadian diet. We also looked at vegetable and fruit intake and found that the mean daily intake of vegetables and fruit for all age sex groups was under 4 servings a day. We found that whole vegetable intake was higher than whole fruit intake. We also found that dark green and orange vegetable intake accounted for less than 1 serving per day for all age sex groups. While this is not a target in the 2019 Canada's Food Guide, dark green and orange vegetables offer an abundance of important nutrients and are recommended as part of a healthy diet. So moving on to our second report, which focused in on beverage intakes, we found that water was consumed in the greatest quantity in grams per day compared to all other beverage choices. And again, this is Ontario data. The findings also identified high intakes of coffee and tea and diet beverages and lower intakes of milk and plant-based beverages. And these are the ones which supply important nutrients such as vitamin D and calcium. Sugar-sweetened beverages provide added sugar to the diet and contribute extra calories, as previously mentioned. In the diet beverage category, we included things such as artificially sweetened drinks, sweetened soft drinks, and vegetable juice, flavored waters, including vitamin waters. What is interesting is the breakdown of beverages consumed by different age and sex groups. For males, children ages 2 to 12, diet beverage consumption was second to water in terms of quantity consumed. And these drinks, along with sugar-sweetened beverages, were consumed in higher amounts than milk, juice, or plant-based beverages. Most concerning is that sugar-sweetened beverage consumption was highest for males in the youngest age group, ages 2 to 5, and second highest for males 6 to 12 compared to the older age groups. For female children, ages 2 to 12, diet beverages and plain milk were consumed in higher amounts than sugar-sweetened beverages. For all children, milk intakes were below 1 serving a day, and coffee and tea were close to half a serving per day. A similar pattern was found in youth 13 to 18 years of age and adults over 19 in Ontario. Among youth 13 to 18 years of age, water was consumed in the highest amount, followed by diet beverages and sugar-sweetened beverages for males. Among females, water was consumed in the highest amount, followed by diet beverages and plain milk. Among adults over 19, water was the highest consumed beverage, followed by coffee and tea and diet beverages. And this pattern was similar for both males and females. Diet beverages accounted for more than 1 serving per day for youth 13 to 18 years of age. And sugar-sweetened beverages consumption was highest for males 13 to 18 and lowest for females 19 years of age and older. Among youth ages 13 to 18 years old, plain milk intake was less than 1 serving a day. And for adults 19 and older, about half a serving a day. As with younger children, plant-based beverage consumption was less than 1% for those ages 13 and older. From 2000, now I'd just like to move on to some trends reported by other researchers who have noted some eating pattern changes, which could explain some of the nutrient observations we've just gone over. Polsky and Garriguette, for example, found the average number of total daily vegetable servings consumed by Canadians declined in all age and sex groups, except in children under 9 in 2015 compared to 2004. Tougault, Lafleur, and Black found that apart from whole fruit, which did not change over time, the estimated average daily intake of dark green and orange vegetables, other vegetables, and potatoes all decreased from 2004 to 2015. In our own Nutrition Connections report, which we released in March, we found that only 27% of Ontarians aged 12 and older were consuming vegetables and fruit 5 or more times per day. In a study done by Garriguette, he reported milk intake was less than 500 mils or 2 servings a day, both in 2004 and 2015. Tougault and Lafleur and Black found Canadians were consuming fewer daily servings of milk and alternatives in 2015 compared to 2004. And these authors cited concerns that this shift could be a problem from a population health perspective if fluid milk is not replaced with other food or beverage choices that provide calcium and vitamin D. In 2004, many Ontario and Canadian children, youth, and adults had intakes below the DRI recommended levels for vitamin D, calcium, potassium, and fiber. Our report showed similar results for vitamin D and fiber below recommendations for all population groups, and potassium below the recommended levels for adults over 19, while calcium intakes were below recommendations for females over 9 and males over 71. Again, it is important to note that this study did not assess for deficiency or adequacy of nutrient intakes, which would have required much further analysis. Some further trend information shows that fruit juice, fruit drinks, and soft drink consumption was lower in 2015 compared to 2004. Also, total sugar consumption overall decreased from 2004 to 2015, but this was attributed to an increase in total sugars from food alone and a decrease in total sugar from beverages. A study by Liu et al. Found that desserts and sweets and beverages were contributing the most to added free and total sugar in the Canadian diet. While sugary drink consumption has declined, the beverages continue to contribute substantially to energy intakes, especially in children and adults. Added sugars, in particular from sugar-sweetened beverages, can lead to tooth decay and excess consumption of calories, which is a risk factor for chronic diseases such as obesity, type 2 diabetes, and cardiovascular disease. Additionally, sugary beverages may reduce consumption or displace more nutritious foods or beverages in the diet. And then there's some studies found by Mubarak et al. Found that over 50% of dietary energy comes from ultra-processed foods that are typically higher in sodium, sugars, and saturated fat. And the intake of ultra-processed foods was highest in children 9 to 13 years of age. So unhealthy eating continues to be a major risk factor for chronic disease in Ontario, as pointed out earlier. The present report found that in Ontario, the intake of sodium was high for all age sex groups, while sodium contributed almost 20% of total daily intake. So our results and those of recent researchers confirm that eating and beverage patterns can be improved to ensure the population is achieving the recommended intakes of important nutrients such as vitamin D, calcium, potassium, and fiber, reaffirming the need to decrease intake of sodium, in particular in the diet of Ontarians. This can be achieved by following dietary guidelines to consume our vegetables and fruit, fortified milk or alternatives, and high fiber whole grains and plant-based foods. Our study has pointed out that children ages 2 to 5 and 6 to 12 had the highest consumption of sugary beverages compared to all other age groups, and this is a priority concern. As noted previously, improvements in following a healthy diet can improve population health and provide substantial savings on healthcare costs. So this brings us to some food literacy policy actions and strategies. There are many ways we can improve the eating behaviors of the population in general, and many strategies have already taken place. For example, at the federal level, Health Canada has a healthy eating strategy that includes guidelines for healthy eating and the new Canada's Food Guide. Health Canada also has improved food labeling, such as updating the nutrition facts table, and is also working towards better front of pack labeling, all of which are intended to help Canadians make informed choices. At the provincial level, other initiatives can have an impact on improving the food choices and the health of the population, particularly children and youth. For example, including food literacy as a mandatory component of school curriculum at every grade, including the training of childcare providers and educators. And currently we have a Bill 216, the Food Literacy Act for students, being considered in the provincial government. It's not passed yet, but it's in progress. We also can support a national comprehensive school food and nutrition program so that all children can have benefit from a healthy meal at school along with food literacy. Providing consistent and harmonized guidelines and standards for food and beverages served in childcare and school nutrition programs is important, as is including increased access to water and restricting sugar-sweetened beverages. It would be important to ban the marketing and sale of sugar-sweetened beverages in school, as well as restricting the sale and marketing of sugar-sweetened beverages in recreation centers frequented by children. Something else we can look at in the provinces, including sodium in addition to calories on food labels and promotional materials in food service establishments, such as we already have the calories listed in the Healthy Menu Choices Act. And this would help to increase the awareness of sodium content in foods. And finally, we can look at providing provincial healthy eating campaigns targeted specifically to children, youth, and parents to encourage eating behavior and eating and beverage behaviors that will improve nutrient intakes and decrease the intake of processed foods high in sodium, sugar, and fat. So that concludes the presentations of the highlights of our report. And our reports will be available in the next week or so. But in the meantime, I'd just like to point out some of the previous work that we've done at Nutrition Connections, where we've been examining the state of food literacy in Ontario. And we've looked at many different ways to improve food literacy and understand who the key players are in the province. So we encourage you to look at the evidence briefs we've created, as well as some of these documents. We also recently hosted a workshop with researchers, practitioners, and policymakers to identify the key priorities for food literacy research and policy action going forward. And we'd encourage you to look at that report called Shaping the Health of Children and Youth. And in that report, we outline some of those policy activities that we could be pursuing at the provincial level. So I am going to conclude here, and thank you for listening to the presentation of our results. This is just the covers of the 2 new reports that you'll be able to access online in the next week. I believe we're aiming for next Wednesday to have those put on the Nutrition Connections website. So thank you.
Thank you, Lynn. That was a great summary of the reports, lots of great information. I do have some pre-submitted questions that we can start with, and then for those on the line, feel free to pop your questions into the Q&A box. So the first pre-submitted question is, can you comment on eating trends among children aged 3 to 5, as well as other age groups, school age?
Sure. As you have heard from our results and the other research on children and youth, we do see that consuming water in higher amounts is a great thing, and certainly it's highest compared to other beverages. However, the concern remains the intake of diet beverages and sugar-sweetened beverages, which are higher than milk and other nutrient-rich choices. So that would be one thing to look at the beverage trends. And then also with vegetables and fruit intake, we saw that the intakes were under 4 servings a day. And vegetables, fortunately, are higher than fruit per se, but the intake of dark green and orange vegetables was only about half a serving a day. So I think there could be some, improvements there. I think the biggest issue we have discovered is to try and reduce the diet and sugary beverage intakes and increase the intake of milk or alternatives and vegetables and fruit to ensure that nutrient needs are being met.
Wonderful, thank you. The next question says, I'm interested in adult data and trends, though family stats are applicable as well. Also interested in information about policy changes that could require or influence industry change, especially around food product labeling and marketing.
Yeah, so I think we certainly presented some adult nutrient trends here, but I would remind people to look at our exploring eating in children and families, because we do have a lot more information in that report, which can help us understand what's driving food choices, especially for families. With regard to the policy changes, Health Canada is currently working on the nutrition facts, has already made changes to improve the nutrition facts table and list of ingredients to make the food labels easier to understand. They've also been through a fairly lengthy process looking at the front of pack labeling to improve people's ability to recognize healthy food choices right when they are shopping. This has been a little bit delayed due to COVID, but I think they have till the end of this year, early next year, to finalize all of those changes from the packaging side. The government's also looking at sodium target reduction. So as you can see, we've got a lot of concern about the sodium levels being quite high, and so the government has voluntary sodium reduction targets for processed foods that came about, and they're from 2020 to 2025. And so those targets are meant to help reduce the overall sodium intakes of the population to about 2,300 milligrams per day, or about 30%. So that's in progress, but the issue, as always, is it's not mandatory, it's voluntary. the government, it does have a process to sort of monitor the food industry to see how they're doing, progressing towards that.
Thank you. Perfect. The next question is about the effect COVID has had. So what impacts has COVID-19 had on eating patterns and trends in Ontario?
Yeah, sure. So I think we're all really interested in knowing about these trends. Certainly, we know that eating behavior has changed slightly, and certainly our grocery shopping and even our meal planning behavior. So we certainly know Canadians were eating more at home and eating out less, although we have seen an increase in ordering from restaurants online, and a lot of increase in ordering meal kits and things like that, and even takeout groceries. So there's a lot of changes in terms of how we're accessing our food. But one thing that we have seen, and this was part of a Canadian Perspective survey series, is that Canadians seem to be consuming more junk food and alcohol during COVID, and we're not sure if that trending is down, is going down. I think we really need another survey that will look really closely at those eating pattern changes pre-COVID and post-COVID. And back to our eating trends study that we did with families with Ipsos, we actually collected that data at the 12 months ending December 2019. So we have some good, solid pre-COVID data that we could then perhaps do another study probably in another year or two, to see if there have been any significant shifts in the way people are consuming foods or their food behaviors and attitudes. So it'll be really interesting to see that. And also, of course, we know that we would need a more fulsome nutrition survey, such as the 2015 Canadian Community Health Survey. And we know that the government does these pretty well spread apart, 2004 to 2015. So it would be really great to see something in maybe 2022 or something, so that we could do those kind of analyses to see what actually has changed as their food choices changed, have the nutrients intakes patterns changed, and those kinds of issues we'd like to know more about.
Great, thank you. And this question is kind of related to what you were just talking about with respect to eating out behavior. So during the pandemic, how the eating out behavior could be affecting nutrition status of Canadians.
Yeah, well, it depends where you're getting your food. So normally, I think pre-COVID, the eating out behavior, people, it depends where you're consuming the majority of your food. If it's at a fast food restaurant where there's very few high fiber, whole grains, vegetables, and fruit available, you're certainly not going to be getting your nutrient needs for fiber, and you could also be getting more fat and sodium and sugar in your diet. So I think it depends where you're getting your foods. If you're ordering from a healthier restaurant that offers healthier choices, then it may be no different for you.
Thank you. So our last of the pre-submitted questions, I know it's not something that these reports commented on, but if there's a comment that you can make regarding eating behavior of children in school settings, so whether it's through SNPs or food coming from home or purchased at school, if you could just comment on the sort of eating behavior of children at school.
Yeah, so we didn't specifically look at children in school as part of any of our studies. We were really looking at ages and stages. And we had noticed when we were doing our food literacy series that there wasn't a lot of data on 2 to 5-year-olds. So we purposely set out to study the population ages 2 and up. So we broke down the data results into 2 to 5-year-olds, which is more of a preschool area, and 6 to 12-year-olds, so that we could get that nuanced information that we were looking for those age groups. We also did that with our nutrition trend study with our families. And we actually broke it down further into parents with children of different age groups, so we could see what was happening with the parents. So I think the results are similar to what I would have presented today in terms of what you're going to find with that, with the nutrient intakes and beverage intakes for this report, and then different things with our food trends, eating trends report.
Perfect.
And they're
Thank
pretty
you.
aligned. I have to say, for example, in our food trends report, we found that water was the most consumed beverages and that plant-based beverages, for example, weren't highly consumed. So there's a lot of consistency between the reports for those age groups.
Awesome. Thank you. And thanks for pointing out all of those other reports. And it just really does speak to the importance of data collection and, covering the different ages and stages. As you mentioned, those nuances really do make a difference, right? They really help our understanding and help us to target our initiatives and policy actions. So if there aren't any other questions, which I don't see any coming in, we can get ready to sign off. I do want just to mention a couple of the upcoming events we're excited about. So one is around mental health, and it's really actually a great workshop. A lot of us have attended at NC. So this is Resilience and Preventing Burnout and Anxiety, June 24th. So the information there is at the events link. You can get lots more information and sign up. As well, July 6th and 7th, we have a career development workshop, 2 half-day workshop for nutrition professionals. And great instructors, awesome content, so please check those out. And then, thank you. Yes, we're a little early, but I'm sure that's okay for people. Thank you again for attending the webinar, and for Lynn for sharing all of this great information, and again for all of those years of collecting data and providing those reports, which we have available on our website. So please check those out. Also, just a reminder, we will be sending out an email with a survey link. All the responses are anonymous, and we really appreciate your suggestions and feedback to help us improve our webinar programming. So thank you all again, and enjoy the rest of your day.
Thank you.